Hi, my name is Andy. I'm going to be your student physical therapist today. What is your name and how old are you?
Hi, young man. My name is Margie. I'm 65 years old.
Okay. And what brings you into physical therapy today?
I've been having some pain down this leg here. Yeah, it's really been bothering me.
Okay. Um, is it only the one leg? What about the other side?
No, this leg's fine. It's really just this right leg over here.
Okay. And when did it start?
Yeah, I don't know. I had hip surgery a few weeks ago, and I think they were saying they stretched out one of the muscles, and I don't know, something happened. But I
Okay.
feel like ever since that, it's just been getting worse. This whole leg, you can tell it's just way more swollen than that one, and I don't know.
Yeah, I can tell.
Yeah.
Yeah. What are some of the symptoms that you feel down that right leg?
At night it's hard to sleep on my back. During the day, I like to sit. I'm a retired candle maker, and it's hard for me to sit down and make these candles. Walking for a long period of time, yeah,
Okay. Okay.
it's hard.
How is your walking? Do you feel like it's more difficult? Do you feel like you're dragging your feet or anything like that?
I think my foot kind of does this thing sometimes, or just like slaps on the floor, and I don't know why it's doing that.
Okay.
It makes it hard to walk, and just this leg's a lot bigger than the other one too.
Yeah. Yeah, I can tell. It's a lot bigger.
Mhm.
So what? So how would you rate your pain right now? 0 out of 10.
Yeah, I mean, like sitting here is one of the things that kind of makes it bad. I would say around a 7.
Okay. And what's the best it's felt in the past few days?
Around a 4 maybe. 3.
What do you do to make it go down from that top number?
It's hard to tell really. It doesn't really seem like anything
Oh.
helps. It kind of just feels like it's there.
Okay.
It goes down every now and then, but I don't really know anything specific that makes it any better.
Okay. Okay. And what's the worst it's felt?
Oh, sometimes it's like a 10.
A 10.
Yeah, it's really bad.
And what do you do to make it go up at 10?
I think walking for a long time or sitting for a long time. Really just sitting or doing something in one position for a long time.
Okay. Okay. Do you have any numbness or tingling?
I have a little bit kind of going down my legs, like a little bit here on the front, kind of this, inside area of my leg, and my foot, I feel like I can't feel it.
Okay.
So, yeah.
Do you have any past medical history that I should know about?
Um, no, I have diabetes, but
Okay.
yeah, other than that hip surgery, I'm pretty good.
Okay. And have you had any unexplained weight loss recently?
Actually, yeah, I lost a bunch of pounds,
Oh.
like about 30 or so.
Oh,
and,
wow.
Yeah, since that hip surgery actually, which is weird because, I haven't been walking much, so it's kind of like, I don't know why that's happening.
Yeah, that's something that we have to investigate further, for sure. Any night sweats?
No, nothing like that.
Okay. Do you have any bowel or bladder issues?
No, nothing like that.
Do you have any night pain?
No.
Okay. All right, so we're headed on to our objective testing. Let's go.
The lumbosacral plexus is derived from the ventral rami of the L1 through S4 nerve roots. It's divided into the upper lumbar plexus L1 through L4 and lower lumbosacral plexus L5 through S1, and it's found within the psoas major muscle. In terms of epidemiology, the median age is around 65 years old, with females being more prevalent than males. Risk factors include neoplasms, hematomas in the pelvic area, mechanical or stretch injuries after a hip surgery, diabetes, or a direct trauma. Unilateral is more common than bilateral plexopathy. In terms of the subjective, the patient will tell you that they have severe pain that's localized to the hips, the glutes, proximal thighs, and radiates down into the posterior thigh and the lower legs. You'll have sensation loss and muscle weakness in the lower extremity. Aggravating positions include supine, prolonged walking, sitting, and Valsalva. Positional pain will tend to bring on this pain as seen with the aggravating positions. Unilateral lower extremity edema will be present, an occasional foot drop, and some red flags they might tell you are significant weight loss and or bowel bladder dysfunction.
So first, I would do range of motion, and that would be all normal. I would do palpation, and that would not reproduce any symptoms. And palpation of the low back, lower extremities would not reproduce any of her symptoms. Next, I'll do dermatomes, myotomes, and reflexes. And specific segments will be affected or diminished. And for this patient, her left side is the unaffected side, while the right side is affected. So, does this feel the same as this? Okay, good. Does this feel the same as this?
I kind of really feel that left side.
Okay. Does this feel the same as this?
I really feel that left side.
Okay. Does this feel the same as this?
Just that left side.
Okay. And does this feel the same as this?
Just that left side.
Okay. So I would test the myotones on the left side. It would be unaffected. I'm going to test the right side now. So go ahead and bring that right knee up. Good. Go ahead and hold it for me. Hold it, hold it, hold it. Good. Go ahead and straighten out that leg. Good. Hold it, hold it, hold it. Good. Go ahead and put your foot up. Okay, hold it for me. Hold it, hold it. Good. That's weak. Go ahead and bring the toe up. Hold it, hold it, hold it. Weak. Go ahead and point that foot down. Hold it for me. Hold it. That is weak. And the last one, bring the heel to your butt. Good. And that is also weak. Next, I'm going to test reflexes. And the left side will be normal, and the right side will be diminished. Diminished. So let me know when you feel your pain.
Oh, right about there.
Right about there. Does that reproduce your pain?
Yes.
Yeah. Can you go ahead and lift your head up towards me? Does that reproduce your pain?
Yeah.
Okay, go ahead and relax. How about this?
No.
Nothing?
Yeah, I'm good on that side. Just a little tight, but.
Okay, good. Can you lift your head up? Nothing? Okay.
Objective testing for lumbosacral plexopathy would include a positive straight leg raise on the affected side, decreased strength of the iliopsoas, quadriceps, hip, AB, and adductors, the hamstrings, discal, ankle, dorsiflexors, and plantar flexor muscles, decreased or absent reflexes both in the patella and the ankle, decreased or absent sensation in the lower abdomen, inguinal region, the entire thigh, medial lower leg, and or the entire foot. In order to qualify for lumbosacral plexopathy, you would need involvement of at least 2 different root levels from at least 2 different peripheral nerves. If the cause was traumatic, you may have point tenderness over the spine and or bruising over the spine. You will find that range of motion is within normal limits. The key diagnostic test for this would be an MRI. If there was a malignant tumor found on the MRI, you would refer to oncology to surgically remove the tumor. Other than that, you're good to go ahead and treat this patient.